and welcome to another Rush Generations Health Education Lecture. Rush Generations and our staff is delighted to be your source of information, resources, and health promotion programs that help maximize your well-being and good health as you age. Today is Wednesday, June 18th, and I'm Franco. I'll be your moderator for today's lecture, Maintaining Mobility. Before I present you our wonderful speakers joining us today, I'd like to first thank Hannah Weitzman for helping with the production of this lecture and helping us manage the chat and other key aspects so that we can all have a great discussion about staying mobile in our homes and in the community. As always, we're live streaming this lecture via our YouTube channel using the video platform Zoom, which allows us to host a good number of people who join us via phone. Thank you so much for joining us. And for those on YouTube, we ask that you please use the chat function to ask questions and or to add to the discussion throughout the lecture. We will make sure that your comments and questions make it to the presenters. And for those of you listening to the discussion via phone, you'll also have an opportunity at the end of the presentations to unmute your audio and so that you can ask your questions as well. We'd like to remind you that all information offered here is for general informational purposes only, and to always seek additional professional advice for situations specific to you and your needs. All right, without further ado, I'd like to introduce our panelists for today. Today joining us will be Dr. Prasanna Patel. And Dr. Patel is a board-certified internist currently completing a fellowship in geriatric medicine with plans to pursue a clinical career in rheumatology. Her academic and clinical interests lie at the intersection of aging, autoimmune disease, and patient-centered care. Welcome, Dr. Patel. Our other panelists today will be Mary Granados. Mary is a falls prevention program coordinator at Rush Generations in the Department of Social Work and Community Health. She obtained her Master's of Social Work in 2019 and Bachelor's of Social Work in 2013 from Northeastern Illinois University. She is pursuing an LCSW. With over a decade of experience in the field, her diverse background includes supporting refugee children, individuals experiencing homelessness, and a significant focus on older adults. Mary enjoys reading, thriller and suspense books, baking, and traveling. Welcome to you both. And now, without further ado, I'd like to pass it on to our first presenter, Dr. Patel.
Good afternoon, everyone. Welcome to this wonderful lecture about mobility. This topic is very close to my heart, so I'm really glad to be talking to you guys about this today. So today on our agenda, we have 10 things that will hopefully simplify the topic and encourage you to keep moving. We will first talk about why this matters, then talk about simple daily goals, what changes with mobility in terms of age, barriers to mobility, and of course, addressing not being embarrassed about this. We'll also briefly talk about keeping your home safe, using tools that could help, how movement even a little bit adds up. And then towards the end, we will emphasize setting a goal and reviewing programs with your providers. And ultimately, 5 quick things you can do today. So let's get started. First, why is this important? Why does mobility matter? Mobility is how you move through the world, getting around your house, doing errands, visiting friends, or simply standing up from a chair. Good mobility helps you stay safe, avoid falls, keep your muscles and brain active, and do what matters most to you, whether it's playing with your grandkids, gardening, or attending community events. Mobility is linked to staying physically fit and being able to live on your own for as long as possible. So it is very strongly tied to independence, your safety, mood, and of course, quality of life. It's never too late to focus on mobility, as this helps maintain strength and function. So what should a daily goal be? Well, every older adult should move safely every single day. Setting a realistic goal is what's most important, and this is tied to what matters to you. So everyone's reason for staying mobile, staying active is different. It might be walking to church, grocery shopping, gardening. These goals give meaning to movement and they help us stay consistent. So what is a barrier and what changes with age, right? Some natural slowing is normal. However, decline is not inevitable. You can strengthen your muscles and balance at any age. With simple, regular movement, older adults, and anyone for that matter, can build or maintain strength and balance well into their 70s, 80s, and beyond. Physical therapy helps regain this confidence in movement. So it's a powerful tool to regain mobility after illness or injury. So we expect a lot of small changes to happen as we age. However, it shouldn't be considered an inevitable part of it. So it's very important to pick up on small changes that you may have noticed as you get older and share these with your providers, as there may be things that they can help with. It is very easy to fall into this trap of, well, as we age, we slow down, this happens, my joints are going to hurt, and it's normal. However, when you recognize that there are things you can do for this, that this normal may not be something that you're going to be stuck with, then your life changes and it really transforms. So barriers to mobility, right? We know all these things, and yet what's stopping us from getting moving? One of the most common challenges, a real life challenge that many people have to deal with, is pain. A lot of times, like I mentioned earlier, joint pain is a big, big, big concern in older adults. And it almost seems to go hand in hand with aging, even though that is not truly the case in everyone. And as you feel pain in your knees or your ankles and your hands, your first instinct is to reduce the movement to reduce that pain. However, it's a bit counterintuitive, but as you get moving, this pain actually should improve. It trains your body to rewire those signals as you feel better and better when you get moving. So in the beginning, it may be difficult to overcome the pain, but as you keep at it, as you have your providers help you with a good regimen, then this pain will no longer be a barrier to movement. It will actually improve with movement. The next one is balance problems. And I do want to highlight this today because the fear of falling is oftentimes something that stops people from moving. And it's a valid concern. We know how dangerous falls can be, especially as you age, and all the trauma that comes with it, all the aftermath that you have to deal with, the fear of people stopping you from moving once you've fallen. So all of that can be a huge barrier in people wanting to maintain their independence and continue to move. So to address this, if you have concerns with balance, then it's another thing that is very important to discuss, not just with your medical professionals, but also your close support systems, your friends, family, or anyone that you surround yourself with, as they can help you plan things around yourself that can help you with balance. If there are medical things that are interfering with this, then your providers can help. Ultimately, if you advocate for yourself and if you are openly able to discuss this, then you have tools to help you overcome it and ultimately get moving and do what matters most to you. Medication side effects are a very important part of this. One of the important things that I'd like to recommend today is to have your doctor or pharmacist review all the medications you take, including the over-the-counter ones. We oftentimes don't consider supplements as medications, and we may not realize that these play an important part in the way that our body is receiving everything else. So it's very important to recognize the value of including this information when you go to see your medical providers, as they can look up interactions. If you have heart medications, you have kidney medications, you have blood pressure medications, all these can and may be interacting with your supplements. And it's not to say that you should stop all of them. It's just keeping an open mind and being transparent with your provider so they can help you the best that they know how. So as you get older, the way that medications work in your body can change. So sometimes you may be on a medications for 20, 30 years and not have any problems. However, as your body is changing and that medication remains the same, the interactions may change. The way that your body is getting rid of that medication or processing it may be different. And because you're experiencing this on a daily basis, you may not pick up on those changes right away. And that's when a provider can come in and help you recognize those. Some medications or even combinations can make you sleepy or dizzy and cause you to fall as you get older. So it's always very important to have this discussion with your provider. Always review medications every time you go in. If you have questions regarding the medications, even if you've been on them for a long time, please discuss these with your providers. Vision and hearing changes, right? It's very trivial and oftentimes overlooked. If you are having trouble with your vision, if things have been different, for example, seeing clearly at night may be challenging. And so if you're getting up in the middle of the night to use the restroom, you may have the risk of tripping over something. So these are some of the things that may not immediately come to mind when you're thinking about movement, but they too do play a very important role. Same thing with hearing. If you're walking around and someone's trying to get your attention because you may be about to bump into something, or you may have missed something. And if you're not able to hear those signals, that could also be dangerous. It is also important to have a full range of our senses working to the best they can to help you move safely in your environment. So if you haven't seen your eye doctor in a couple of years and you wear glasses, that may be worthwhile to follow up with. Like I said earlier, it's something that may be changing over time very slowly, and you may not have noticed. However, once you get it checked out and when that is improved, then you will notice the difference. And ultimately, it is all keeping you safe, keeping you independent, and keeping you moving. There's also the challenge of hazards. This is something that we will expand on in a little bit, but it's things like loose rugs, poor lighting, just things in your surroundings that we can modify to help you move in a safe way. And the last point, which, is a real life challenge, is embarrassment about slowing down or even using devices. And we will also expand on this because it is not a failure on your part. And it is also not something to be embarrassed about. It is something that we have to advocate for ourselves, be proud that we're thinking about all of these things, because ultimately it is to improve your functionality and be the best version of yourself. So, what do I mean by not being embarrassed to talk about it? Many people feel embarrassed about needing help or using devices, and it's understandable, especially if you've been independent all your life. It feels like you're giving up control if you're asking for help. It feels like you may be going towards the end of the line if you need help. It may feel like you are a burden if you're asking for help. It may also feel like there may be pressure to slow down if you ask for help because people will be concerned. And all of these feelings are valid. So if you are embarrassed or worried about this, a safe place to start that conversation is with your provider. Screening is normal. A lot of providers are trained to do this as you get older. And there's no age cutoff. There is, just here's what we do for everyone, regardless of what you look like, how much you weigh, what's going on. We do this for everyone. Screening is a big asset that we have. It's a tool that helps us identify things early to get a head start before things get bad. Just like screening for cancer, right? Oftentimes we only screen for medical things. However, it's really important to remember that this is also a big part of your life, and thus we screen for this. So when your providers do offer this, explore. If you're not sure what they're planning to do, why they're doing it, ask questions. I encourage you to ask questions instead of being afraid of undergoing that. So this ultimately helps your medical team identify strengths and needs. It's normal. It's not a sign that something is wrong. And it really just helps your care team tailor support to you specifically. And that is the idea. There is no blanket treatment or recommendation for everyone. Every individual is different, and everyone will need or may not need support at the same level. So you may hear your providers talk about something called the timed up and go test. This is a very simple test that can be performed during your office visit, and they can help identify early issues and, most importantly, prevent future falls. So if your providers are mentioning this, be curious, be open to completing that screening. And if they are not, and you, after this lecture, figure out that it may be important for you to undergo that, bring it up. It is a completely valid thing to talk about with your doctor. So, how can you keep your home safe? We have a few different tips, and I'm sure I have missed a lot, but I do want to highlight the major bits. So ultimately, the idea is to create a safe environment around yourself. So a few things you can do. The first thing is to remove things you can trip over. Things like papers, books, clothes, shoes, all of these from areas such as stairs or places where you walk. So even as you're entering your home, if there isn't a space for your shoes, and if they're in the middle of the hallway or just by the door, then that's a hazard that you may trip over. It's not to say that you're not being careful. It's just the way things go. Sometimes you may be in a rush, or your lights were off and you did not notice. It's all one of those scenarios where, oh, I wish I had just seen it, or I wish I wasn't hurrying into this. And it's always the afterthought that will make you wish that things would have been different. So this is more prevention, anticipating that if it comes to it, if there's ever a time where something happens and I did not plan for it, then this shouldn't get in the way. The second thing is to remove small throw rugs or use double-sided tape to keep them from slipping. This is a very minor thing. I myself have tripped over rugs, and so I am very careful about this too. Sometimes the edge can be a little curled up that you may trip over. Sometimes you're rushing and your slipper gets caught in it. Could be anything. So just being mindful of that and taking these extra steps to secure them if you are going to keep those rugs there. Another thing is to keep items that you use often in cabinets you can reach easily, or with, oftentimes we may end up using a step stool. And so the idea is to be able to reach these easily without a step stool. Again, it's not to limit yourself. It's to be just prepared. You know, when things start changing, then you may not have time to prepare your surroundings in that moment. And so preemptively taking these steps and preparing for the future, that always makes the transition easier. Another thing that you can do is add night lights or brighter bulbs. And this is, goes back to improving your vision. It's not just about, hey, my vision is changing and I need glasses. It's also, how can I make things easier on myself by brightening up my surroundings, right? Again, it's just using the tools that you have to make things a little bit safer and easier to navigate around you. Something that goes along with this is also using grab bars in bathrooms. So whether it's by the toilet seat, whether it's to go into your shower. For the shower, we always recommend, like a standing shower you can go into if you will have trouble with going over the edge of a bathtub or using lower bathtubs, things like that. So regardless of you having different kinds of shower settings, having that grab bar to enter that space is always safe. When we're talking about the bathtub itself or on shower floors, non-slip mats should be a must. I also use these. It's a very easy thing to include in your bathroom, and it just instantly makes you feel safer. And lighting isn't just in your bathroom, right? So it's also lighting up the space that you may use at night. So if you're using a certain path to go to the restroom at night, in the middle of the night, right? So having access to light as soon as you're able to, before you put your feet on the ground, you should have access to turn on the light, or having a night light that lights up the path to your bathroom, things like that. You can also have lightweight curtains or shades that reduce glare if during the day it's too bright, because now you're on the other extreme where really bright lights are interfering with how you view your surroundings. So it's finding the right balance. For your home itself, having wobbly steps or handrails can be very, very tricky. And so fixing these can make your home safer. Handrails are a must, and you should have lights on all your staircases. And lastly, something that we can do for our person, ourselves, is to wear well-fitting shoes with good support. And this should be for inside and outside the house. Non-slip shoes, even inside the house can be very helpful. It also protects your feet from anything that you may encounter. And if they're well fitted, then they also prevent these pressures on your feet. And that can help you keep moving more than you normally would. A lot of times our feet get tired, and some of it can be attributed to just ill-fitting shoes. So having these looked at by occupational therapy, for example, they can make recommendations. So that's always a nice, comfortable thing to add to our routine. And with any of these things, really, physical therapy and occupational therapy are a big, big asset. They can really help you plan how to navigate these spaces in a safe manner. So I would definitely encourage all of you to explore that and ask your provider about it. Moving on to other tools, the first thing I do want to emphasize is tools are a strength and not a weakness. We have to normalize using canes, walkers, or other aids, because ultimately these tools help you stay independent longer, and that is the goal. So they're safety tools, not a sign of failure. right? It is you showing off, hey, look, I can still walk with my walker, or this cane lets me go and hang out with my grandkids. So many people end up waiting too long to utilize these tools and they end up falling. And then it seems very debilitating. So the idea is to incorporate these early on and ultimately include them in your life so you're preventing the things that may have happened if you hadn't used the tools. You have to take pride in proactive self-care. And of course, getting the right fit matters. So physical therapy can help assess and teach you the safe use of these. They can help you navigate what kind of device would be the best fit for you and what to look for when this is no longer working. Is it time to maybe change the device? Is it time to change how we use it or in what setting we use it? So it is an ongoing journey. It's not one answer for the rest of your life. And ultimately, early support means fewer injuries later. And fewer injuries means you get to stay independent for longer and you get to stay active for longer. So don't let a cane or walker stop you. It's okay to use your cane or walker if you already have one, as these can improve your balance and help take the load off of the painful joints. So, how much should you be moving? Well, you don't need a gym to move. Low barrier and sustainable movement is key, especially if you're just getting started. So things like standing up during commercials or after reading for a while, doing gentle stretches when you wake up in the morning, or walking during phone calls. Walk in the hallway, taking a walk around the block. Light chores and gardening count too. That's still movement. The idea is that something is better than nothing. And small things, if done regularly, do add up to big changes. Walking, I have to say, is a very popular form of exercise, especially among older adults. And it's a great choice. Walking is something that you can start any day, even today. You can start with 5 minutes and build up to the recommended 30 minutes a day. So what can walking do for you specifically? Walking has shown to strengthen muscles. It helps prevent weight gain. It lowers the risk of heart disease, stroke, diabetes, and osteoporosis. And it also lowers the likelihood of falling. As you're improving all of these things, you're improving your balance and strength. So the recommendation is to try to walk as fast as you can while you're still able to chat with a friend while walking. So it's not running. And 3 tips for safe walking that I'd like to go over today. One is to always be aware of your surroundings. So you plan to walk during the daytime or in well-lit areas in the evenings. Keep an eye out for uneven surfaces, especially if you're walking outdoors. The pavement could be crooked, there could be potholes. So you always want to be mindful of this. Always keep an eye out for possible obstacles and any other tripping hazards. The second tip for safe walking is to stay hydrated. So bring a bottle of water or any other low-calorie liquid with you, and be sure to drink plenty of fluids if you sweat. And the third tip is, especially in a city like ours, dress properly for the weather. If you're walking outside, wear layers of clothing so that you can take off the layer if you're hot, or put it on if it's getting cold. So I hope these will be helpful, as every bit counts, even as little as you getting up, maybe during this lecture, to stretch out a little bit. Every bit counts. So, setting a goal and reviewing progress. One of the first things that we had talked about today was what matters to you. So what's your why for staying mobile? This is something to reflect on for today. figure out why this will be important to you and what this means to you. So some of the goals could be to walk to the mailbox and back daily, could be get up and stretch every hour, could be to work in my garden for an hour every day, whatever it looks like to you. Thinking about this and coming up with a plan, setting a goal for yourself, that is the most important first step. And of course, discuss these goals with your provider and your family and friends and your support system, and revisit them regularly, as everything is dynamic. Things can change, goals can change, and plans can change. So this is something that you're always coming back to. Now, to kind of round things off, what are some of the things you can do today? One is move a little every day, including today. So like I said, as we're doing this, you can get up from your chair if you're able to, move around, stretch your arms, whatever it may be. You can, if you're going to watch TV later on, get up during commercials, anything, any kind of movement today. It's never too late to start, and it's never too early to start. The second thing that you can do is talk to your doctor about any of the barriers that you may have in getting moving, to achieving your goals, and to doing what matters to you. So things like pain, dizziness, or weakness. The third thing is to make your home safer. We talked about a lot of different hazards in the home. We talked about loose rugs, using lower cabinets, improving lighting, things like that. So just looking around, see what you notice that could be dangerous as you start moving, as you increase the amount that you're moving. The fourth one of my favorites, is to use mobility tools proudly. This is something that we have to set an example in, because if I use it and it's improving my mobility, my friends will see that, my family will see that, and they will also feel empowered to do the same, ultimately making us all more independent and helping us live a healthier life and follow a healthier lifestyle so we can live longer and live happier. And the last one is to set a personal goal tied to what matters, and then track your progress and revisit as things are dynamic. That is all I have for today. I hope this was helpful, and I hope you will take away something from today's lecture and keep moving. Thank you.
Thank you, Dr. Patel. And now our next presenter, Mary Granados, will be joining us to take over for the next part of the lecture.
Hi, everyone. Hope everyone's having a nice day. That was a lot of great and useful information on how to improve mobility. So I'm here to share a little bit about our falls prevention programs here at Rush. Hopefully some of you are feeling motivated and want to take action on becoming more mobile. So we'll get on and start with our fall prevention programs. One of the workshops that we offer here at Rush is called Matter of Balance. So in this workshop, you learn strategies to overcome your fear of falling, to return to higher social and physical activity levels. So this workshop meets twice a week for 2 hours for 4 weeks, but it can also meet once a week for 8 weeks. We discuss everything about fall prevention, how to get up safely from a fall. We have, during one of the sessions, we have a healthcare professional show up and answer any questions you may have regarding falls. And they'll do a demonstration on how to safely and correctly get up. We show you how to do exercises specifically designed for the course. So you'll be able to do these exercises at home, and we'll provide all the exercises for you in a printed manual. Like Dr. Patel mentioned, sometimes you may want to do some exercises during commercial breaks. So we'll teach you how to do some that you can do in your home. Um, this workshop takes a holistic and comprehensive deep dive into strategies to enhance balance and fall prevention. We provide communication tools with how to effectively communicate with friends and families about what's important to you, and how to navigate tasks of daily living. So sometimes it can get difficult to do daily tasks like cleaning or running to the grocery store. So we provide a support among others who are experiencing the same struggles, and we try to figure out how to deal with those struggles and how to safely accomplish these tasks. And then we also help you become your best self advocate. We want you to feel confident to speak up with family, speak up when you go to your doctor's appointments. Um, our next session for Matter of Balance is actually beginning in August. As you'll see on the right side on the slide, it'll be Tuesdays and Thursdays from 1 to 3 p.m., August 5th to August 28th, and it'll be in person on the Rush campus. If you're worried about parking, no need. We do provide free validated parking. Next, please. Okay, so then during this workshop, you also reduce your fall risk and improve your balance. So like I said, it's 8 sessions. We teach you how to view falls as controllable, and how to set goals for yourself to improve your mobility. We want to make sure you're setting goals that are attainable. We also provide some tools for you how to safely make home modifications that you may need. Sometimes you may think, oh, I'm doing well, but maybe just adding, like Dr. Patel said, changing the rugs if they're slippery, or other modifications like putting a night light just so you can see in the dark. So we provide a lot of those tools during the workshop. And then, like I mentioned, the exercises, they'll increase your strength and balance. And then we provide a home safety checklist. So during this session, you'll be able to take the checklist home and check each room, like the kitchen, bathroom, bedroom, and it'll be very detailed. And sometimes you may think something's not a fall risk, but it really is. So it's really good to have that handy. And then the last thing is it reframes the way we think about falls. So it's an action we can control rather than an event that just happens to us. So that's the gist of what Matter of Balance is, but we'll move on to the next one, which is Fit and Strong, which we also offer here at Rush. This one meets 3 times a week for 1.5 hours for a total of 24 sessions. This one you improve lower body strength. So for this one, we provide ankle weights for you to use during the sessions, which we do in the fitness center at Rush. Then you also gain more mobility and balance by doing the lower body exercises. You can reduce your pain and improve the function of your lower extremities. It also helps lessen anxiety and depression. This workshop uses flexibility and strength training, aerobic walking, and health education to improve balance and strength. So not only are we doing exercises using the ankle weights, but we also provide the resistance bands to use, so you can also work a little bit on your upper body, because when you do fall, sometimes you do put your hands out and you need to build that strength in your upper body as well. So it's also important to look into that. Oh yeah, so then the next session for this one It is Mondays, Wednesdays, and Fridays. It is from 1 to 2:30. It'll be beginning September 29th to November 21st, and it'll be in person on the Rush campus. And again, parking is free. We have Tai Chi also for arthritis and falls prevention. This is a two 1-hour classes. Hold on. So this is for 8 weeks. I am confusing myself. 2 1-hour classes weekly. So it's twice a week for 8 weeks. It is offered on Zoom, but we are currently working on bringing it out to the community. We're training more leaders, so eventually you'll start to see it more out in the community. In Tai Chi, we do warm-up exercises. There's 6 basic Tai Chi movements that are taught and also 6 advanced Tai Chi movements. You can do them sitting or standing. If you participate in 11 of the 16 classes, you receive a graduation certificate at the end. And we also have another upcoming session, which will be available by Zoom, and it'll be Wednesdays and Fridays from 11 to 12, starting September 17th to November 7th. And lastly, we have bingo size. So this one's a lot of fun. This one is a 10-week program that combines the exciting game of bingo with fall prevention exercises. So you meet twice a week and you learn techniques to prevent falls. Bingo size is for the mind, body, and spirit, and it's a lot of fun. We play upbeat music during the exercise portions, like we have our own playlist, or you're able to make requests. Whoever wins in bingo, they're able to choose from an assortment of prices as well. And then, so with the exercises, you're improving your upper and lower body strength, your gait, balance, and range of motion. It also improves cognitive function and increases social engagement because you're talking to everyone in the group and just having fun, especially during the exercises. Improve knowledge of fall risk prevention and important health topics. So these are 4 different workshops that we offer at Rush. So if you're interested, please do reach out. Here's my contact information, and yeah, I can register you for any workshops. Thank you so much.
Thank you so much to both of you. Thank you, Mary, and thank you, Dr. Patel, for this engaging and informative lecture and much needed reminders sometimes, especially for myself as well. As I was listening to some of these suggestions, I was like, I need to check that on my home as well. So just to recap, some things that I know will help wrap up some of the themes for me today is mobility is more important than movement. It's about being able to do what matters most to you, whether that's walking your dog, cooking your own meals, dancing with your grandkids or friends, maintaining mobility, and helps preserve independence, dignity, and joy. We often associate aging with inevitable decline, but today's speakers showed us that decline is not a destiny. There are tools, strategies, evidence-based programs that help empower adults to stay mobile, safe, reduce pain, and stay engaged. Programs to Rush Generations like Matter of Balance, Fit and Strong, Bingo's Eyes, and Walking with Ease aren't just about exercise. They're about building confidence, reducing isolation, and reframing how we think about aging and movement. Also, let's keep in mind mobility and fall prevention are closely linked. So when we strengthen muscles, build better habits, and reduce home hazards, we're preventing injuries and enhancing the overall quality of our lives. So movement, the last thing that I really took away as well is movement adds up. Something is better than nothing. That's a great motto to walk away with. So walking is a great tool to help you maintain strength and mobility. So check out our program, Walking with Ease, which we cover great technique for safe walking and much more. It'll be available later this summer. Check out Rush Generations for more information on how to register. And now I'd like to have both of our moderators, both of our lecturers today join us for our Q&A. Thank you, Dr. Patel, and thank you, Mary. Anybody who is on the call today, if you have any questions for either Dr. Patel or Mary Granados, our Rush Falls Prevention Program Coordinator, please unmute yourself by hitting *6, and we will also take questions coming in from our YouTube live chat. I know a question that came in for you, Dr. Patel, is you emphasize setting personal movement goals tied to what matters most to you, which I love. Can you share how providers, family, friends, or caregivers can help patients identify and stay accountable to these goals?
Absolutely. One of the first things, in setting these goals is to do it around what matters to you. So I think in a way, when things matter to you and when that's the most important thing in your life, you yourself keep you accountable. And that's one of the reasons why we want to work around, not just the provider's goals, but also what your goals are. A way that you can have your family and providers keep you accountable is by letting them into this part of your life and sharing these. And that is something that I touched on about reviewing these with your providers on a regular basis. So if your provider knows that you're going to be gardening, your provider may ask you, as I do with my patients, hey, let me see those plants that you've been planting. Let me see what your garden looks like now. And so, it's one of those things that everyone connects on different levels. A lot of us have common hobbies. Sharing these with your family, they can help you with these goals. They may even join you with this, and that way it keeps you accountable. So those are just some of the ideas.
Thanks again. Those are great, valid points. Obviously, communication is the key takeaway from this. Communicate with your healthcare team, your family, and your friends to let them know what matters to you, which we push as well very heavily through the Shaman Senior Voices initiative. So this is just a great reminder that the more you share what you love and how you want to stay active, that you're also helping yourself by letting folks into your life and also helping you stay accountable. Great reminders. Mary, your program's really focused on confidence and as well as physical strength. How do your participants' attitudes, how have you noticed your participants' attitudes change by the end of our workshop, like Matter of Balance?
Yeah, so you can really see that connection happen during the workshop. At the beginning, of course, everyone's new, they don't know each other. So by them sharing the same concerns and just doing the exercises together, they're all learning from each other because it is, the workshop's not really a lecture, it's more of a conversation and very communicative. So everyone's discussing throughout the whole time. So by the end of the workshop, they have become really close. They stay in contact afterwards and sometimes even join other workshops together. So you can see a dramatic difference in their in how they are at the beginning to the end.
That's so terrific, and what a testament to these evidence-based tools that Rush Generations is offering, for sure. Dr. Patel, we often associate, there it is. You mentioned embarrassment as a barrier. How can caregivers and clinicians gently encourage conversations about assistive devices or changes in functions? And how does someone overcome these internal barriers in the flip side of in asking for help?
This is an excellent question. This is actually a challenge that we continue to face. And we hope that through talks like this, we can try to overcome that barrier. I do think that, again, it falls down to communication and the language that we use, right? So even something as simple as, avoiding words like wheelchair bound. It is not who you are. It is simply a tool that you're using. It's very similar to, even something like taking medications for blood pressure. Having high blood pressure does not define you, right? These medications keep you healthier, and they help maintain what you are supposed to, what your idea of living a healthy life is. And so I think the conversation should begin as to how this is helping you lead that healthier lifestyle. One of the things that, we can explore with patients is always, or anyone, for that matter, anyone in the community, is always start with what matters to you, right? So it's, hey, I want to be able to go and see the sunrise every day. And to do this, to fulfill this, if I have to use a cane, that's fine, right? So it is an extension of you. It is something that you're using to achieve what you want. It is ultimately leading you towards that. And if we change that perspective, if we reframe these tools, right? It's not, I can't walk and that's why I need a cane. It's, I still want to be able to see the sunrise and this cane lets me do that. So I think it's just, re-emphasizing all of that with yourself and the people around you that'll really encourage people to embrace this. And also, like I said previously, if I do it, I'm gonna, encourage my friends to do it, and they will feel empowered. Hey, this person, just by using a rollator, is able to do all of these things. I want to be able to do that.
Wow, thank you so much. I mean, that is a great example of just reframing, right? How do we reframe our mindset? And so I think I love that example that you use of like, it's not that I have to use this now in order to get around, but I want to use this so that I can do those things that I love to do, get around. So thank you so much for that. Mary, a question came in from somebody who is out of state, and they are asking, I live out of state. Can I still take advantage of the Zoom Tai Chi class? And who should I contact, or whom should I contact?
Yes, you can. That's the good thing about having Zoom options available. So I know my email was on a slide, so feel free to email me or give me a call, and I can sign you up.
And for all those callers and folks joining us on YouTube, I want to remind everyone that this is being recorded and will live in our YouTube library. So you can reference this at any point to like any of the slides, or also just have a reminder of the wonderful conversation that we had today, and to get contact information like we just mentioned. So Mary's contact is there, will live there. And you can also look up Rush Generations Facebook or Rush Generations contact information, and we'll be able to sign you up that way as well. Another comment, a comment was made from our YouTube for Dr. Patel. I love the reminder that a diagnosis or mobility tool is part of what we do to continue to enjoy life rather than who we are. We are so much more than a diagnosis. That was a comment that came in from YouTube. So thank you so much. Well said. That's exactly what a great takeaway. And then Dr. Patel, could you speak how physical therapy assessments can support both prevention and recovery when mobility starts to decline?
Absolutely. And I probably will not do justice to this, to all the work that they do. But I will try my best. So physical therapists and occupational therapists are trained to really identify the intricacies in your movement and how you interact with the world around you. So, even the initial assessment, if you are worried about falling, if you're worried about your balance, and this is something that your provider is able to refer you to, then physical therapists and occupational therapists can work with you to identify where they can modify these things, right? It's working on your gait, for example, working on how to use handrails and grab bars around you, or how to find your balance when you feel off balance, and how to incorporate these tools. So they're really well trained to not only introduce tools in the way you move and in your life, but also not to overdo it, right? So if they think you can get away with a cane, they're not going to recommend a rollator for you. They're really good at that. So I would trust their judgment, and I would trust their assessment. And of course, all this is hand in hand with the rest of your medical team. So it's really, you know, a team approach, and the most important member of that team is you.
So well said. The most important member of that team is you. It is, and a team is there to help you. So you are the individual that individuals like Dr. Patel and all the other professionals that were just discussed, like PTs, OTs, or a rheumatologist, audiologist, is there to help you and assist you in your journey as you continue to age well. So discuss with your professionals. Mary, somebody asked, does Rush Generations offer balanced screenings, and how do I take advantage of that?
Yes, we do. We go out into the community and we bring the screening. So if you yourself are interested in having a screening and know maybe you may want to bring us to your church or a school or your senior building, we can always make that happen and have it accessible for others where you're at. But also just by asking your doctor, you can also get a screening done. So there's many ways to get it, but yes, we do offer screenings.
Terrific. And earlier, I know someone asked about registration and also for this balance of screening. If anybody doesn't have the moment to look up Mary's email, you can also email rush_generations@rush.edu. Again, that's rush_generations@rush.edu. Or you can also call our 1-800 number. That's 800-757-0202. 800-757-0202. Okay, so at this point, I think that wraps up our Q&A. We could spend here, I think, many more minutes or hours, I would say, talking about this wonderful topic of mobility in the home. I know I have taken away so many great reminders and also just great new tips for me around the house. So thank you both for joining us. And for those watching and listening, stay tuned for our next classes that I will tell you about next. So upcoming events. The first one is the Wellbeing Series, Creating Balance, and Wellness from Within. It's not too late to sign up. This workshop is a transformative 6-week program designed to help you tap into your body's innate ability to heal and thrive. Through a blend of mindfulness, acupressure techniques, and the science of habit formation, this series empowers you to take charge of your well-being from the inside out. You'll learn science-backed practices that support your mental, physical, and emotional health, helping you create lasting change and balance in your life. This is a 6-week class. The cost is $25, and partial or full scholarships are available. Our next workshop will be held in person at the Rush campus on Tuesdays, starting July 8th and running through August 12th from 1:30 to 3 p.m. Free parking is also available for those that join us. Our next workshop that we'll talk about is Learning to Live Well with Chronic Pain, a 6-week workshop with people living with chronic pain. Participants engage in discussions, skill-building activities to better cope with the day-to-day management of chronic pain. All sessions incorporate an exercise element and strategies for medication management, pacing activity, and rest, etc. The next workshop will be held at Rush campus on Wednesdays, July 23rd through August 27th from 2 to 4:30 p.m. Again, free parking is available. Next, Shaman Senior Voices would like to hear from you. Shaman empowers older adults to discuss what matters most to them as we age. It's important to share what matters to you most with your physicians and loved ones. Please consider sharing your wisdom on why it's important for your healthcare team and loved ones to know your goals and wishes and what matters to you most at aging.rush.edu/Shaman/collaborate-and-connect, or scan the QR code that you see right now on the screen to record on a mobile device or smartphone. And lastly, our next lecture, Maintaining Independence Through Prevention, will be on Wednesday, July 2nd, starting at 1 p.m. as always. And lastly, I want to thank you all for joining us today. And don't forget, if you have any questions or want to know more about anything that was discussed today, please visit our YouTube channel. Or if you have any questions about registering for any of the workshops that we just talked about, reach out to us at 1-800-757-0202 or visit our Facebook page at facebook.com/Rush Generations. And we thank you again for joining us today. Have a great, safe day.